we'll see about the dural venous sinus. So dural venous sinus, it can be formed by two ways. That is either between the two layers of the dura mater itself, or between the or by the meningeal layer itself can reduplicate, and between those layers a dural venous sinus can be formed. The characteristic features are present, that is, it will be not having any valve or muscles, smooth muscles. Then it will be directly draining into the internal jugular veins. Next thing is about the classification. Unpaired and paired are there. Unpaired will be learning 4, that is superior, inferior, straight and occipital. So the first three is formed by falx cerebri. We already know that we have discussed in the previous video, and occipital, it is by the falx cerebelli. Next thing is from where it is forming, and next thing to what it is continuing as. Superior will be continuing to right, inferior to straight, and straight to left transverse, and occipital will be included in the confluence of sinus. To learn this thing, we have a small trick, that is, we have to keep this order in mind, that is superior, inferior and straight, like cis. Then the code is right side, left side. So right for right transverse, side for straight, L for left transverse, and side this was just for a sake. Next thing is paired dural venous sinus. We have sphenoparietal, cavernous. Cavernous is very important, it will be dealt in another video. But cavernous sinus, enough to remember that it is formed by the it is formed between the meningeal and endosteal layers of the dura mater. Sphenoparietal means it is formed along the lesser wing of the sphenoid, and drain into all the things will be draining into the cavernous sinus. Same way the superior petrosal and inferior will also be draining into the cavernous sinus. And transverse sinus, as we have learned before, transverse is having both right and left, right from the superior sagittal and left from the straight sinus. Both the things will be joining to form the transverse sinus, and at the point where it leaves the tendorum cerebelli, it will be continuing as the transverse will be continuing as sigmoid sinus, and the sigmoid sinus ultimately it will be draining into the internal jugular vein. As we have said, that is a very important feature, because all the sinus will be draining into the internal jugular vein. Next thing is about the clinical anatomy, that is sigmoid sinus thrombosis means sigmoid sinus is mainly related to the thin plate of bone, that is a mastoid antrum. Therefore, any infection from the middle ear or mastoid antrum can lead to thrombosis of the sigmoid sinus. And same way superior sagittal sinus, it is also having it is also the veins from the scalp and diploic veins are also draining into the superior sagittal. So therefore any infection of these areas can also cause the thrombosis of the superior sagittal sinus. So this is about the dural venous sinuses, and cavernous sinus is very important, it will be dealt in another video.